Welcome to the Rich Feet Podcast with Dr. Tanisha Richmond. This podcast is sponsored by the Richmond Foot and Ankle Clinic, where they specialize in happy feet. Each episode highlights the best of Dr. Richmond's radio show, providing bite-sized clips of advice. Let's jump right into the show.
Good morning, good morning, good morning. This is Dr. Tanisha Richmond from Richmond Foot and Ankle Clinic at the Charles R. Drew Health Center, 1323 West 3rd Street. I am open Monday through Friday, 8:30 to 5. We do close from 12 to 1. Right now, currently, we are accepting patients. We are probably, for new patients, 2 to 3 weeks out. Follow-ups depends on 1 week, 2 weeks. Currently, I am the only podiatry practice in the city limits of Dayton proper. So be patient when you do call in. Our phones ring nonstop. We do now have the ability for you to text us at 937-228-3668 or call us. You can also reach out to me through my website at richfeet.org. You can put in a request and we can reach out to you that way as well. And you can also, if you Google me at Richmond Foot and Ankle Clinic or Tanisha Richmond, I think, and you can actually contact me directly through Google as well. So today has been an exciting day for me already because I am also a board member for Diabetes Dayton, which is at 2555 South Dixie Drive, Suite 112. Their phone number is 937-220-6611. So already this morning I have set up a booth. One of my workers is working at Island Park for Dove's Cry, which is an event going on right now from 12 to 3 today. And it looks like it's going to be a lot of health screenings and other events. So if you are out and about and need somewhere to go, there would be, it's called Dove's Cry at Island Park today from 12 to 3. And then speaking of Diabetes Dayton, I am currently a board member. I joined the board last year. And, you know, one thing we're trying to do as a board is let people know we exist. So our website is diabetesdayton.org. But you know, this past week, we actually had a board meeting and they actually took us on a tour of their food pantry. So we do have a diabetic friendly food pantry. You can go there and get diabetic friendly food items, which is actually picked out by a registered dietitian. We have a diabetes pantry. We have free insulin, emergency insulin. We have needles. We have lancets. We have all kind of glucometers to check your blood sugars, blood pressure cuffs. So we have tons of supplies there if you are lacking on your supplies or anything. And then we also have 2 type 1 diabetics who work in the office as well. So if you are a new onset diabetic and you're having some questions about how to use your meter, how to eat right, how to learn how to live with diabetes, all of that is on site. We also have a monthly diabetes support group that's free. Right now, they are offering free hemoglobin A1C test. So hemoglobin A1C tests that is the blood work test that a doctor can draw your blood and tell if you are diabetic and also tell how well your diabetes is controlled. So a lot of people actually get diagnosed, they're symptomatic, and then they run an A1C and their A1C may be 13 or 14, and a normal A1C is 7 or less. So 7 or less, you're hovering 100 in the hundreds. Your average blood sugar is in the hundreds. 13, 14, your average blood sugars is in the 3 to 400s. And any kind of damage to the body happens when your blood sugars hover consistently over 100. And that's when you get into the diabetic neuropathies, the numbness, tingling, burning in your feet, how you get into the other complications from diabetes affecting your eyes, affecting your kidney function, things of that nature, and also affecting your circulation in your legs. So if you are diabetic, It's a good organization to reach out to, especially if you're looking for a dietitian, someone to teach you how to eat. If you're having issues understanding carbohydrates and carb counting and all the different parts of being a diabetic, Diabetes Dayton can help with that as well. And then later on this year, I think in October, we're going to have our diabetes walk. And then following that walk, immediately following will be a diabetes expo. So if you have family members or friends and you want to do a group and do a walk, be a group walk, or do, form a group, or in remembrance of someone that may have passed from diabetes, that would be awesome. Because Diabetes Dayton, we are looking for support and we're looking for people to interact with us. We have quite a bit of grant funding to use for different projects, especially the hemoglobin A1Cs. So even if you have a church home or organization, you actually could call the office at 937-220-6611. As for Susan Litke, if you had an event where they would have enough time, they could even send someone out in person to check hemoglobin A1Cs on the spot and give out free hemoglobin A1C testing. So that's one of the things that's going on today. And then as far as the radio show, I think I will be having a guest later on. They'll be talking, we'll be doing the book of the month. For our monthly book of the month, we'll be calling in later and just talking about general foot things. This is summertime. Everybody's coming out. Everybody's looking at their feet. Everybody wants to wear sandals. So they're looking at their feet. I would say the biggest thing you're going to start probably noticing this time of year is probably athlete's foot and toenail fungus. So if you're looking at your feet and your feet are peeling, bottom and sides of your feet, peeling on the bottom, and the peeling is in little circles, like the circle peeling. And then also if you have the odor, and then also if you're looking between your toes, it is white or green, you probably have athlete's foot. And then also this time of year, since we're getting into the bug season, people are getting a lot of bug bites. So most of the time you know what bug bites look like, the raised bites. So that's a different problem, but I can also order you a cream. Most of the time I'm trying to order you a cream to make you stop itching, and then order you a cream if you break the skin, you don't get infected. But generally that's on the top of your foot. There are bites everywhere. So that's more for bug bites. Then we're talking about dog-cat bites. I see that as well. So same premise. You want to be putting some antibacterial ointment on that as well, keeping it clean. Cats can carry, I think it's a bacteria called Ichinella. It's a nasty bacteria that cats carry in their mouths. Dogs carry bacteria as well in their mouths. So never let them lick your wound or anything like that, because you know what, dogs like to lick themselves as well as cats. So be careful with that as well. And then, of course, signs of infection is redness, pus, drainage, pain. So if you're seeing that, and it's even in interdigital tinea, which is the athlete's foot between your toes, that can go on to a super infection, which is a mixture of bacteria and fungus. So most of the time when people come in with that nasty interdigital tinea, I have to coach you to make sure I'm putting you on something that covers everything that's living in between your toes, because that can get bad. And if you have been recently incarcerated and recently released, you could have a super infection of interdigital tinea and athlete's foot. That's the worst. Athlete's foot I always see is someone that's recently been released from prison, because of the communal bathrooms that you have to use in prison. And I don't know if they're providing slippers and things like that, and if they're cleaning properly. But the worst case of interdigital tinea I ever saw came from a gentleman who had just got out of prison, and we had to put him on antibiotics and antifungals by mouth to cure his fungus infections. So, this time of year, and then of course you got your calluses, you got your hematodes and things you're noticing, your bunions. So bunions, that's the bump on the outside of your foot. That is not a callus. That is the bone that sticks out on the side of your foot. Calluses can be on the bottoms, they can be on the tops of your toes. And then hammer toes are the cricket toes. You know, they're not straight, but they're hammered. So that's a hammer toe. You cannot correct these with anything you can buy offline. The only way these can be corrected after the age of 18 is surgery. Because after the age of 18, your toes, your bones of your feet harden. Really, the only people that we can correct like that usually is infants. Like, there's a way to cast babies that have like metaductus or clubfoot that can be cast. But then sometimes they may need surgery depending on the severity of their genetic deformities that they may have. So you cannot cure your bunions or your hammer toes with any kind of straps. You can put the straps on, they'll hold things in place, but as soon as you take the straps off, everything will pop back, because that is a tissue and bone deformity. And the only way to correct those kind of deformities is surgery. Another thing we're dealing with a lot in Dayton is heel pain, because a lot of people in Dayton work in manufacturing jobs, hospital jobs, we're in the industries, we're in home health, we're on our feet all day. So a lot of people deal with heel pain. So heel pain, the technical term is plantar fasciitis, which is inflammation of the plantar fascia of the foot. So you have on the bottom of your foot a strip of tissue that supports your entire arch and your body weight. So most people get pain like in the back of their heel, and sometimes they'll get pain all the way back here and up the back of the leg. That would be your Achilles tendon. So that's an Achilles tendonitis. And then some people get what's called a pump bump, and that's in the back of the heel, and that's actually extra bone. It's the bone called the calcaneus, and it'll actually rub their shoes and irritate them. Usually I'll tell people you really got to wear kind of backless shoes or soft shoes. Stay away from leather. Treatments for those. So the mainstay of treatment for heel pain and Achilles tendonitis is, first we start off with orthotics, with something that you could wear in your shoes to support your arch and things like that. We're always going to get an x-ray first. So the reason we always get an x-ray is because we want to make sure that it is just heel pain. Because over the years, 2 to 3 cases where I have picked up cancer in a person who was having foot pain. And actually, one of my patients, he had metastatic lung cancer with metastasis to his foot. And eventually we did an MRI, and actually the radiologist called me, told me his primary care was out of the country. So I sent the patient to an oncologist, and he recently visited me, I think last year, to tell me thank you for finding out that he had cancer and he was able to get it treated. So that's why we always x-ray your foot, because it could be cancer, it could be a fracture, it could be a bone deformity that's causing the pain. And lots of times when I do x-ray feet, I do find fractures, especially in the toes, but people never knew they had. So that's another factor. And then, so generally on the initial visit, we talk about orthotics. We also talk about injections. So that's the heel spur injection right into the heel. That's lidocaine and steroid right into the heel. We can do that about every 6 weeks. We cannot inject the Achilles tendon, however, because we can possibly rupture it with the steroid into the tendon itself. And then on follow-ups, we can do things like we can tape your foot. Like you see the athletes, they're all taped up. Most insurances will pay for us to tape your foot like every 10 days. We can send you out for physical therapy where they can actually do stretching with you. We can also give you something called a night splint, which is you would wear it while you watch TV and rest, and it will stretch you as well. And then we also have another device in our office called the ARP neurotherapy. That's another treatment option for any kind of the itises, any kind of plantar fasciitis, any of the inflammations of the foot or pain. And we do those in the office about every other week. And most insurances, well, some insurances cover it, but usually we have to prior off for those as well. But, you know, when I talk about people with heel pain, most people, by the time they've come to see me, they've already tried several different things and tried the stretching, the icing, rolling their foot on a ball and different things like that. But, it's always better to be safe than sorry. So I always say, give me a call, let me know, come in, let me examine you, let me get some x-rays, let me see what's going on, because I can give you an honest and thorough assessment of your problems. The next thing I want to talk about, which is my favorite thing to talk about, is I guess it would be vascular disease. So, and I guess the reason I talk about it so much is my office manager passed February of this year, and he had vascular disease and refused to get it addressed and ended up losing both limbs and then passing. And it was very disheartening because everything that happened to him was preventable. So when I talk about vascular disease, signs and symptoms of that is cramping in your legs when you walk or sleep, cold feet, no hair on your legs, thick, crumbly nails, dry, cracked skin that you cannot put anything on really to make it look better, not even grease, Vaseline. It's still dry and crumbly. If you are a long-term smoker, probably over 5 to 10 years, or smoker of any smoking, not just cigarettes, marijuana as well, and vaping. If you are diabetic, especially if you are uncontrolled diabetic, like saying you're always hovering in the 10s, the 13s, A1Cs, if you are in renal failure, that increases your chances, especially if you are on dialysis, that increases your chances of vascular disease. So when you come to see me, if you have any of those risk factors, we're going to get you scheduled for what's called an ABI, an ankle brachial index, which is a non-invasive test. It's just something where we put blood pressure cuffs on your arms and legs. This prints off a report where it compares your upper blood pressure with your lower blood pressure, and it can tell us if you have good blood flow. And then from that test, we send you on to a vascular specialist who can fix your vascular status. So I always describe them as high-tech plumbers, so they can fix your plumbing if you have blockages. There's things like stents, there's lasers, there's other devices that they could do, and it's usually done as an outpatient procedure. And it's usually done under light sedation, so you don't feel any pain or anything, and usually recover within a week or so, week to 2 weeks from the procedures. But I always tell patients that this is to prevent you from losing your legs, not make you. The people who lose their legs are the people who never have this kind of screening done, or it's too late when they finally show up to the ER. So like signs of gangrene is discolored toes, discolored feet, cold feet. So say you cut yourself and your foot is starting to turn colors. If you're African American, it's turning darker shades of brown, purple. If you're Caucasian, it's usually fire red. And then eventually it can start to turn black. And that's a sign of either dry gangrene or wet gangrene, which is dead tissue. Wet gangrene is deadly because if it hits your bloodstream, you can go septic and die. So if you are seeing that happening and you're getting the odor, the drainage, you're not feeling well, that is a medical emergency. You do need to head straight on to the hospital. There is nothing you can do for that at your house. So you do need to head on to the hospital and let them address that and get you stabilized.
Good afternoon, Dr. Richmond. I've been sitting here thinking and just listening to your great show today, and you've mentioned this before about, and we all have been guilty of putting things off or trying home remedies and just try to make it better, and it doesn't get better. So in your professional opinion and education, educate us on what we need to do when there is a crisis at home and we want to fix it, but we realize we can't, and the need to seek medical treatment.
Well, you just need to have it addressed.
It sounds simple.
But it's just that simple.
Yeah. Yeah, it sounds simple, but if it was that easy, I guess I'm wanting you to speak to. It's not that easy, because if it were that easy, people would do it. So they're not.
Well, most of them, it's just denial. They know it's a problem. They know something's wrong. They know their foot doesn't smell good. They know they have a hole. They know it's draining. They know they don't feel well, but they're trying home remedies. They're calling their cousins baby and boo boo. They're digging up old antibiotics out their kitchen or bathroom and trying things, trying not to go to the doctor or the urgent care or ER. The main part of all this is if you go early, usually we can give you medication to fix the problem. It's when you show up too late, and that's when you show up with gangrene. Then at that point, the tissue is dead, and the only thing can be done is an amputation. And then they may try to fix your blood vessels and try to get blood flow to keep the remaining tissue or the foot or the leg. But you have to get there early. That's the same thing I tell patients about ingrown toenails. If you come to me when it's just poking you and it's not pussing and nasty, I can just cut it back. But if it's pussing, infected, inflamed, then we have to do procedures to take the nail out, because the body is now reacting to that nail like a foreign body, and it's not going to calm down until you take the nail out. So it's more of it is just letting us see. Like if you're at your primary care doctor, or you're with your nurse practitioner or your health provider, show them your foot. Let them know what's going on. We have urgent cares all over the city now. There's urgent care at Trotwood, St. Elizabeth Place, North Main, South Main. So, these are the places you need to walk into if you can't get to me. Like I'm open Monday through Friday, 8:30 to 5. If you have a problem, you can text us 24 hours a day, actually. You can call the main number, 937-228-3668. You can reach out through my Google page. If you Google me, you can contact me directly through Google. You can contact me through the email, through my website, richfeet.org, or you can go to your primary care physician. So you have places to go, but you have to go, and you have to. I understand the fear, and I understand what happened to your mom, your dad, your grandma, your auntie, but that was 10, 20, hell, if it was just 5 years ago, technology has changed. We're changing as we speak. We're talking about AI and all this different technology that's hitting. I mean, we're in an exponential time of healthcare and advancements and new drugs and new treatments. So what may have happened to your mother or father, your cousin or auntie, probably won't happen to you, because we have technology now that didn't even exist in their lifetime. So I would just say, talk to someone that is a healthcare professional, at least a nurse, LPN, RN, NP, PA, physician, podiatrist. Talk to one of us and let us see what's going on with your foot. Do not sit at home and soak it in vinegar and what is the other stuff? Apple cider vinegar and onions and garlic and all this other stuff you find on the internet. Come to us so we can treat you and hopefully take care of the problem so you will not lose any body parts.
So we have a question, Dr. Richmond, from Janet. She says she's enjoying your show. She says, I have nothing wrong with my feet. They, to me, look good. And then she put LOL. She said, but what would be the process if she just wanted to come just to have a regular yearly checkup just for her feet? Can she do that through her primary care, or can she come directly to you just to be checked?
She most likely needs to come to me. The only insurance I know of right now that's requiring prior auths or referrals from their primary care is Aetna, the Aetna plans, and I'm not on Anthem plans except for the Medicaid. So, but in general, you could just call and schedule an appointment. Basically, when you come, I just do a full exam. I'm looking at your neurological, your vascular, your derm, your ortho. So I'm looking at every system of your foot and how it relates to the rest of you and your status. Because a lot of people may think there's nothing wrong, but then I may pick up like athlete's foot or calluses, things like that. Or even I may pick up vascular disease, depending on your other health problems. So it's always a good idea just to come in and let us check you out, because prevention is always key. You know, you may have a cut on your leg that's a little angry, a little swollen, a little red. I may need to get you some ointment. I may need to put you on some antibiotics. So, it never hurts just to come in and let us take a peek.
Good information. So hopefully the caller got that message. And for any other listeners that may have a concern of their life that just want to come and make sure they're okay, they can stop by. Then I can also come to just get the foot bath, right?
Oh, yes, we have the foot spa. Right now, it just runs on Thursdays and Fridays. You call the office at 937-228-3668. It's $25. So that's a foot spa, scrub, massage. You're in a private room with music and Pandora and lights, a massage chair. You can schedule that with a regular appointment, or you can use your insurance, like to get your nails or calluses done, or see one of the podiatrists for any kind of medical treatment, because they don't do your nails or calluses. Only that's done by us. So a lot of patients do that in conjunction with their appointments, and some just do it without their appointments. They just come monthly or every few months to do the foot spa.
That's good to know, and that's on Thursdays?
Thursdays and Fridays.
Okay. Any particular time frame?
I think they're one an hour, so like one at 9, 10, 11, and then one at 1, 2, 3.
Can you talk to us a little bit about the polishes that you have there? I know a lady mentioned not long ago that she was surprised at how many different colors that you have.
Oh, yeah, we have medicated toenail polish where you can paint your nails and treat your toenail fungus. We now have a new product line of medicated foot soak kits, where if you want to soak your feet at home, they're medicated with antifungal and antibacterial medication in it. So if you wanted to buy our kits, you can take it home and soak your feet as well. Just be careful if you are a diabetic. You always have to check the temperature with your elbow, or have someone that's non-diabetic check your temperature, because diabetics can lose temperature sensation, which means they can burn their feet and not feel pain. We also offer diabetic socks, compression socks. We have all kinds of hammer toe pads, bunion shields, callus pads. We have sandals with orthotics built into them that you can put around in the house in the summertime or outside. We have diabetic shoes. We have a nice diabetic shoe line. It's through Anodyne Diabetic Shoes. You want to look at that online. Or you can come to the office. We have a full display of all our diabetic shoes. And they're quite cute now. Only people that would know they're diabetic are other diabetics.
Lots of variety to choose from.
Yes, they're very stylish. We have diabetic boots. So they're not steel toe, but we do have diabetic boots as well.
So you've talked about several things today, Dr. Richmond. Can we start from the top? And if you would, please, for those that are just tuning in, just maybe give us a recap of where you started from today. When you finish with today's recap, maybe talk about your plans for next month and the conversations. We know you'll be back with us on the 4th Saturday of July. It's hard to believe we're going into July soon. And, of course, that's going to be July the 22nd. July the 22nd. That's the 4th Saturday. So today you started with...
So today I started with Diabetes Dayton. Actually, when I leave here, I'm going back to Island Metro Park. They are having an event, I think Angels Cry or something. But I'm actually a board member now for Diabetes Dayton. So I have a table there for Diabetes Dayton, as well as a table for me. And I was just talking about all the things that Diabetes Dayton offers now. They're at 2555 South Dixie Drive, Suite 112. And their number is 937-220-6611. So at Diabetes Dayton, they have a diabetic food pantry. They have an insulin pantry for people when they run out of insulin. They have a pantry for all your diabetic supplies, your needles, your syringes, your glucometers, blood pressure meters. They also have nutritionists on site, dietitians on site. They do have a diabetes support group that you can sign up for. We have a diabetic type 2 camp. Actually, I think that's coming up next week. And then also are working on projects to work type 2 camp and type 1 camp. And I think we're doing another thing for type 2s and pre-diabetics as well. So if you are a new onset diabetic and you have some questions, it's a great place to stop, because there are actually type 1 diabetics. So they do understand diabetes and how to use a meter and how to explain how to eat and how to take your insulin and all the different parts of being a diabetic as well. I talked about heel pain, talked about Achilles tendonitis, treatment options for that. I talked about vascular disease and how we screen for vascular disease, which is an ABI, which is just a blood pressure cuff on your arms and legs. And people who are at risk for vascular disease is all diabetics, all smokers, all people on dialysis. Pretty much everyone over 70 years old should be screened for vascular disease as well. And it's just kind of like your plumbing. It just clogs up over time. So just by living that long, over time, you can build up blockages in your legs as well. And then we had the book of the month from Dr. Johnson, and that's a good read book club. You could go to her website. I think she has website, Facebook, Instagram. But every time you search in a good read book club, I had JW Winery call in. They are located in Trotwood on North Main. I think he said next to the Grisma Tire and across from the new Goodwill. They have built in Trotwood. I think they're open now. And they have wonderful wines. They have all different kind of flavors. They have sweet wines, dry wines, and they also do private label wines. And I think she said if you buy more than 12, it's only $2 more to make the wines private label if you want for special occasions. And then I think that's about it. So we also have the boutique on site in my office. So if you're just looking you need some diabetic socks, compression socks, or some pads, some hammer toe pads. We got lotions, we got creams, we got toenail polish. We now have new foot soak kits for you to soak your feet at home if you like. And then we also have the spa, x-ray, vascular testing, and everything on site. And if you're having a foot or ankle problem, just call us at 937-228-3668. You can also text us at that number, or you can contact us through the website directly to me, and you can also contact us through Google directly to me as well.
All right, so it looks like Janet's still listening. She says, oh my goodness, I can buy your foot soak and I don't have to buy Epsom salt?
It's Epsom salt infused with antibacterial medicine and antifungal medicine.
Oh, it's got what it needs in it.
It's everything. It's already pre-mixed.
And she said, can I just come to your office and purchase it?
Yes.
Okay. Yes, you can, Miss Janet. And anyone else that would like it, you can stop by Dr. Richmond's office right here on West 3rd Street in the beautiful Wright-Dunbar Business District. And, of course, you want to call her at 228-3668, 937-228-3668, or stop by the Dr. Charles R. Drew Healthcare Center located at
1323 West 3rd Street. When you come in, make a right, head towards Wick. We're right next door to Wick.
You have to stop at that location. But
well, if you're already head towards Wick side. We're right next door to Wick.
All right, Dr. Richmond, we thank you so very much. I appreciate you being with us on the 4th Saturday of every month. You will be back on July the 22nd, but right now, for those of you that would like to meet you out at Island Park, you're headed there now.
Yes, till 3 o'clock.
All right, so 3 o'clock. And again, tell us what's happening out there today.
I think it's Dove's Cry. It's an event held by a local church, and they're going to have all kind of healthcare vendors and I think performances as well.
Okay. Well, Dr. Richmond, thank you so very much. Your final comments.
Take care of your feet. You only have two.
We hope you enjoyed today's show with Dr. Richmond, sponsored by the Richmond Foot and Ankle Clinic. The clinic is located at 1323 West 3rd Street in Dayton, Ohio. Zip code 45402. To book an appointment, call 937-228-3668, or you can learn more at richfeet.org.